Hello everyone, Teacher Aunei here. Today, teacher will be talking about Developmental Coordination Disorder, or also known as DCD. So before we go further in, what is actually DCD? What is Developmental Coordination Disorder? So DCD is one of the neurodevelopmental disorder in the world according to DSM-5. It is a substantial difficulty in coordinating movement. So movements such as climbing playground where you need to use both the hand and the feet, movements such as playing catchball, where you need to have visual and also motor movement of the hand, where movements such as complete handwriting tasks. Complete handwriting meaning if you can follow the correct alphabet pattern, capital or small alphabet, write it in proper lines, and also movements such as getting dressed. So it's from probably opening the zipper or the buttons, putting your hands in or putting your leg in. Do you need to pull your shirt downward or upward? So all of those coordinate motor coordination, if they have a substantial difficulty in moving them, in coordinating them, there a possibility that the child have neurodevelopmental disorder, which is developmental coordination disorder. And for those who falls under the disorder category, usually the discoordination, the inability to coordinate their movement, will interfere with everyday activity. So think as simple as opening their shirt, opening their pants when they want to take a shower would be disturbed. According to the DSM-5, or Diagnostic and Statistical Manual of Mental Disorder, there are four main categories that can determine whether someone have a developmental coordination disorder. So the first symptom they look at is the low acquisition and execution of coordinated motor skill. This can be shown through slowness and inaccuracy of performance. So most often people will just call these children clumsy. For example, when they're walking, they tend to hit the chair, the door. When they're wearing shirt, for example, they miss a button, or they miss a zipper, or they miss a hand. So these actions that are normally deemed as clumsy might actually indicate a symptom of developmental coordination disorder. So another symptom of DCD is the skills deficit is significantly interfering with activity. So, for example, it will impact academic productivity, pre-vocational activity, leisure, or even play. So, for productivity, for example, as I mentioned, writing just now, if a child is unable to write properly according to the line, according to the capital alphabet and the small alphabet, this might impact their ability to proceed further in the academic skill. So they might be stuck in a certain skill, and hence it hinder them from developing more academic skill than they actually could have. Next, the symptoms would be that this onset, the start of all this discoordination in movement has happened in the early developmental period. So it is not something that occurs suddenly. It's not something that occur when they're already 20 years old, for example. But it is something that the parents or the people around them have seen that the child has been struggling since their early developmental period. So since probably a very, very young age. And lastly, the DSM-5 stated that these symptoms are not better explained by other disorders such as intellectual disability or visual impairment or even other neurological condition. For example, if they already have a intellectual disability disorder, then they would not be diagnosed with a developmental coordination disorder. So it should be a standalone disorder only focusing on the motor movement. But this does not mean that if a child have other diagnosis, that they do not have a motor discoordination. This just means that to be diagnosed with specifically developmental coordination disorder, they must not be explained by any other disorders, neurodevelopmental disorders. So how would I know if my child have DCD? Some of the common features of a developmental coordination disorder is that they might experience difficulty in more than one areas, in more than one motor coordination areas, or they might also have difficulty in one specific motor coordination area. For example, a child may appear clumsy or awkward in movement compared to their friends of similar age. For example, running awkwardly, maybe their movement, you could see that their movement of their hand and leg might not be as synchronized as other people when they're running. They could also have poor body awareness. So they might have trouble determining the distance between themselves and other objects. This is where people would often see them as clumsy, where they knock over objects, they bump into other people, or even they invade other people's personal space without intending to. Is because they are not aware of how big of a space their body needs. The third one would be difficulty with or delay in developing gross motor fine motor skill. So the development of their motor skills is not coordinated with their age group. For example, as a 7 years old, probably as compared to their peers, they could have already jumped with their 2 feet. However, a child with DCD would not be able to or would have difficulty in doing so. Another common feature would be there would be a discrepancy between their motor abilities and their abilities in any other areas. For example, they might be very intellectual and have good language skill. However, when we look into their motor skill, they seem to be have some delay. Like I mentioned just now, for example, a 7 years old kid might already be able to speak fluently without any error, would be able to determine right or wrong, would be able to excel in the academic performance. However, they might not be able to jump correctly. They might not be able to run with alternating leg and hand movement. This shows that they might be having features or symptoms of developmental coordination disorder. So other than that, DCD also shows movement planning difficulties. So they have difficulty planning physical movement into a controlled sequence, such as remembering which leg to go next, which hand go hand in hand. If I put out my left leg, should I put out my right hand or my left hand? So there will be a difficulty in planning in which sequence should my body move. Another symptom or common features of child with a DCD is difficulty with activities that require the coordinated use of both sides of the body. So bilateral movement would be very difficult for people with DCD. For example, when they're cutting with scissors, they might be holding the scissors correctly, but they would be having difficulty in controlling the paper with their other hand. Another features is learning movement. So they would have difficulty learning new movement and to generalize what they learn in other setting. For example, if in school they learn how to jump rope. However, when it comes to uh, jumping over the drain, they might find it difficult and they wouldn't be able to use their previous skill set of jumping over rope to jump over the drain. Lastly, another common feature of DCD is difficulty organizing their school desk, their school bag, homework, or even the space on a page. So this is where the academic interference comes in, because they are having trouble with coordinating their movement, planning their movement. This would then goes into a bigger planning, such as how to organize, how to make sure their school desk is clean when they're wanting to do work. Is because they could only focus on one area of their movement. They are unable to do a larger field of movement. Now, if we see, if me, you, the parents, the school, the teachers, the caregivers, if we could see that our child might have some symptoms of developmental coordination disorder, or even being diagnosed by a specialist of having DCD, how do we manage them? How do we support these children so that they would be able to function normally, or at least to their best abilities? So first of all, of course, we need to encourage them. Encourage them to keep on trying, to keep on using their motor skills to develop new skills as well. And how do we develop new skills? If we give them opportunity. So we provide opportunities for them to succeed by simplifying the activities. For example, if the same child who needs to wear a shirt just now want to try, if we were to just give them a button up shirt, this might cause stress because they'll have difficulty in doing so. So we simplify it into giving a shirt with probably only one button, or we start off with a shirt with a zipper. So we simplify the activity so that whenever they succeed, it would be gratifying for them. So this come next where you teach them step by step. So when you introduce a new skill to them, or if you want to encourage a certain skill in them, you teach them step by step. So they can predict what comes next. So if you were to button a shirt, first you move their hand towards the button. So step by step, if they are able to independently reach for the button, then you teach them how to loop it into the hole, and then move towards the next step and next step once they succeed the previous step. Next is to personalize your skill set. So again, although the motor coordination is a huge umbrella, not all children have the same motor coordination difficulties. So we need to personalize our teaching into the child that we want. After they manage to actually proceed or go through the personalized skill set, then you can generalize it into introducing how to use the skill with peers, or use the skill with other people around them. Okay. If we can simplify the activity, we could also simplify our instruction. This comes next. So the person actually training them, whether it's the school teacher, the parents at home, or caregiver, or even therapist, it would be much better to manage if we use simple instruction. For example, instead of saying, hey, go and button up your shirt, you can say, hold button, twist button, loop button. So use as simple as of an instruction as possible. Next, how do you help them? So you provide and keep on providing. What do we provide? We can provide cues, visual cues, extra time for them to finish it, and appropriate setup. So if it's in school, provide appropriate tools that they need to master a certain academic performance. If it's running at home, probably prepare a safe enough area where they can learn to run and fall at the same time without hurting themselves. Of course, last but not least, is their goal. And to reach their goal, most children works well with reinforcer. So recognize and reinforce their strength first, and also set achievable and realistic goals. If your child is almost independent, then it's okay to go for a big goal. However, if you see that their developmental coordination difficulty is very severe. That's where we do the step by step and simplifying activities, and the simplified activity became the goal. This would encourage them to actually realize that, hey, I can do step by step. And hey, once I reach my goal, I got a enforcer. How do occupational therapists approaches DCD? So there are 9 steps. The first one would be observing first. So you observe the child during play and formal assessment. This is to determine whether the child ability of their motor function, and to make recommendation or to make an assessment on what is it that needed to be taught, or what is it that needed to be strengthened in the child. Afterwards, we devise the goal. So we set up functional goal in collaboration with the child, the parents, and the teacher, so that the therapy has a common focus and everyone is involved. This means that when an occupational therapist devise a goal, the parents and the teachers needs to be aware of it as well. The teachers, if possible, but the parents need to be aware as well, so that they are also able to understand how the goal, what and how to achieve the goal. How do we do that? First, we need to create awareness. So awareness need to be created in the parents, the carers, and the teacher. So they should understand on what are the symptoms of DCD, what are the age appropriate skill that a child should be demonstrating, and what are the current skill level that their child have. This is to give them an idea and to give them an understanding on how to manage their child based on their current level. So afterwards, we can start with the physical skills. So we provide ways to promote physical activity and participation of the child in a team or group activities. Of course, you can start off with an individualized activity first, and then slowly integrate them into a team group play. The fifth step is to see and understand the underlying skills that the child have. So developing the underlying skills is necessary to support the whole body or the gross motor skill and fine motor skill. So what kind of activities we could do to develop the skills is to see for their balance and coordination, their strength and endurance, their alertness, their body awareness, and their movement planning skills. Next, we direct the skill teaching. So take one skill, for example, balance and coordination, and teach them to task-based approach. For example, balance could be teach by walking on balance beam, and then how to coordinate their hand and leg while walking, left hand and right hand and left hand, and vice versa. Next is to educate. So as much as we give them awareness, we also need to educate parents and carer on ways to simplify tasks so that they can use them at home. They can practice them at home. Afterwards, of course, we need to instill confidence in the child. So build self-confidence to enable the child to participate willingly on the next activity. This could be by providing the child with awareness on the struggle that they're on. So acknowledge the struggle that they have and break down specific skills into 1 or 2 step components so that it will be easier for them. Provide opportunities and strategies for them to master the same skill but in different environment. And next, presenting the activity at the right level with the child's ability. Lastly, OT approaches uses sensory processing. So improving sensory processing to ensure appropriate attention and arousal to attempt the task. So this means that we give them sensory input to the child so that they are alert, they are aware of their body, they have more awareness of their body, and they have more attention so that they can actually grasp the skill taught more. I understand, Teacher Aunei, but it seems like a whole lot of work. Can I just wait and see how my child develop? Of course, a lot of time developing new skill or managing new skills can be a lot of work and it's time consuming. However, if you were to just wait and let the child outgrow themselves or let the child finesse their own skill, they might develop more and more difficulty along the line. For example, as simple as following instruction might be difficult for the child. They will also need to manage a full school day, which would lead them to low self esteem and low confidence when they see that their ability is different from peers of their age. This might lead to them being bullied or bullying others for to to compensate for the lack of or the low ability that they have. This would affect their fine motor skill and how they would complete their self-care tasks such as brushing their teeth, changing clothes after they take a shower, or even as simple as shampooing, how to use their fingers properly when they're shampooing. So the difficulty of doing all this, if it keeps on adding up, would cause a lot of anxiety and stress, which would then lead to poor academic performance whenever a new stressor or a new level is introduced. For example, in test and exam, the level always increases, but if the child's level remains the same or progressing very slowly, this causes very high anxiety and stress to them. So, in conclusion, it is important to manage the symptoms early on. If you find your child to have some motor coordination problems, even if they are not yet diagnosed with any motor coordination disorder or developmental coordination disorder, it is important to understand that they are having difficulty and that their development does not cater to their age group. And understanding that and understanding how to help your child is important as well. So I hope you managed to learn a lot from today's presentation. Again, as a reminder to check on your progress whether it's on the correct age group skill. If not, to check further on how to help and how to manage your child abilities. That's all for me. Thank you and see you again.